Hi, my name is Dr. Dana Wasserman, and welcome to the Stigma-Free Society Fundraiser Marathon. Today, I'm going to present to you some thoughts on post-traumatic growth in the time of COVID-19. But first, please read the disclaimer to the left of you, and please listen to these important words. I'm legally required to tell you that I'm not providing psychological services and that this isn't intended to treat, diagnose, or cure any psychological issues you may have. I will be sure to honor your questions so that if necessary, you will be better known when to seek help. So before I begin our talk today on post-traumatic growth, I also want you to look where the disclaimer is. And above that disclaimer is a link. And the link is where you can donate money to the Stigma-Free Society. And let me just give you a few words as to why I think people should donate. First of all, this is an extraordinary organization. To be personal here, when I left hospital, psychiatric hospital, newly minted with a bipolar 2 diagnosis, regardless of my educational pedigree, I felt scared, I felt alone, didn't really know where to turn, even within my own field. So after making a furtive Google search, I came across Stigma-Free Society, went on the website and read the amazing biography of Andrea Paquette. And I thought to myself, this is too good to pass up. I don't know if she'll read my email. So I just brazenly wrote her an email talking about myself and asking her what I could do for this organization. I knew somehow I needed to be involved. Well, I have been embraced, and I have been involved both on the board of directors and as a volunteer on the Stigma-Free Society Youth Wellness COVID-19 Toolkit. It's been nothing short of extraordinary. I cannot praise this charity enough. So please look around for a few bucks. Please donate to this charity. Please let this charity move forward in the face of COVID-19. Those are my words for the Stigma-Free Society. Thank you for that. And now let's move forward with the talk, okay? So today we'll be discussing post-traumatic growth during the time of COVID-19. Post-traumatic growth, or PTG for short, was developed in the 1990s by psychologists Robert Tedeschi and Lawrence Calhoun. They defined it specifically as, quote, positive psychological change in the wake of struggling with highly challenging life circumstances. So as the term says, post-traumatic growth is growth following trauma. And it can become a catalyst for positive change. It involves both the positive adjustment that results from how one responds and how one rebuilds his or her life following a life-changing event, say a worldwide pandemic. And though generalized stress is likely to emerge from traumatic events, I think that's logical, that makes sense. Post-traumatic growth is also as common a response. This I did not expect. Living through trauma can unveil our hidden strengths in how we cope with life's difficulties. Post-traumatic growth is not simply about returning to the world we once knew. Let's look at COVID-19, of course. The question might be, how will life be as we re-enter our environments? Will the world feel different? Will it feel the same? This sense of not knowing is typically anxiety-provoking. Yet we need to sit, perhaps initially uncomfortably, with this unknown. And this is one of the hard parts of re-entering the world from varying levels of physical and perhaps social distancing. We actually don't know what to expect. However, one benefit of sitting with uncomfortable feelings is that we can learn much about ourselves. We, in fact, could enter a new world that could very well be filled with possibility and wonder. I want to talk about resilience next. So it's really easy to conflate resilience with post-traumatic growth, but let me be clear, they're different constructs, so don't conflate them. Resiliency is the ability to bounce back. Post-traumatic growth is what may occur when one might have difficulty bouncing back, and that one finds after a traumatic event his or her entire belief system is challenged. One may struggle with psychological issues such as PTSD. And lastly, one finds that there has been prominent personal change and growth. To some, there is more to post-traumatic growth than just resilience, because we can view resilience as an ability to survive, which is, of course, purposeful and insignificant. Whereas with post-traumatic growth, not only does one survive, but one also experiences significant positive changes. The emotional, psychological, and existential pain that comes with recovery from trauma can elicit personal growth, perhaps in a different way than being only resilient and bouncing back without additional insight and introspection. Achieving post-traumatic growth is fraught with difficulty and struggle. I won't lie, at least that's what I've read. However, we already know that positive change in life can be quite challenging. It sounds odd, but there is something to sitting with your frustration, anger, confusion, and sadness. And as I've said before, don't bother stuffing your emotions down or avoiding them entirely. They will come back. Instead, we can feel these emotions and honor them without, of course, letting them control us. So I want to talk about some research that's been done too, just to understand post-traumatic growth and how it may manifest within us. And then I'd like to talk about some characteristics that we ourselves can work on to help increase the chances of growth after trauma. So according to some research, post-traumatic growth generally manifests in 5 main areas. Number 1, appreciation of life. You don't take so much for granted. Relationships. There are better and healthier connections to others, and you are more compassionate and empathic. New possibilities in life. You become increasingly motivated to achieve goals that are personally meaningful. Dreams that were once on hold are now being actively pursued. Personal strength. You now have the recognition that you can stand and even thrive within the face of difficulty or even a trauma. You are comfortable within yourself, at one with your skin. And number 5, a spiritual or an existential change. We begin to examine our purpose in life and recognize that we are interconnected to something greater than ourselves. And there are some benefits to having post-traumatic growth. And some of the research here talks about changes in self-perception. That is, as we gradually adapt to, quote, a new normal, which will probably be when we re-enter our world after COVID-19. And I know a new normal is a term I'm well aware people have tired of, but it seems rather fitting here. We also realize that we possess a far greater internal potential than we might have realized. Changes in the relationship with others. There seems to arise a sense of togetherness among those who collectively face stressful events. There are improved relationships, an increase in empathy and altruism. And number 3, a change of philosophy in one's life. We may begin to rethink deep within the core of what really matters, as well as discovering a renewed appreciation for each day lived. So as you see, the journey to post-traumatic growth is a daunting process, and it is the epitome, I think, of having what I would call having severe psychological growing pains. Make sure if you do go through this, make sure you have a plan for self-care in the form of making a list of activities that are healthy and nourishing for you. Some examples include, and I've included these examples in some of my tough talks, meditation, practicing mindful living, walks in nature, if possible, and if you are comfortable, and yoga. Self-care is our anchor. It is our grounding device as we journey into transformation and growth. So then, of course, the question is, well, what do I have to do to get through a trauma like COVID-19, in one piece? How do I even thrive and grow and transform from this experience? Well, there's some characteristics that are highly correlated with growth in these areas. Openness of experience. Keeping an open mind increases chances of post-traumatic growth. specifically during COVID-19, when our routines and schedules have been turned upside down. We have a chance to be creative in how we live our lives in this, quote, new normal. Extroversion. Okay, when I read this, my first thought was, uh-oh, I don't have a chance here because I am a rather significant introvert. However, what the research is actually referring to is offering ourselves as a support to at least one other and to have the support of at least one other and to not isolate, as I have explained in some of my tough talks. Um, just because we are physically distanced does not mean we have to be socially distanced. And therefore, chances for post-traumatic growth are increased when we use things like Zoom, FaceTime, phone, email, text, just to stay connected to people. Spirituality. Now, this one I found interesting because this does not need to be specifically attached to organized religion. Highly correlated with post-traumatic growth is feeling as though we are part of something greater than ourselves and that we value a sense of character in ourselves and in others. Again, meditation and mindfulness help to bolster chances for post-traumatic growth. Acceptance. Also strongly correlated with post-traumatic growth is the ability to accept what we cannot change and to learn to adapt to new situations. This sounds a lot like COVID-19. Fighting against that which is unchangeable only serves to increase internal discord and suffering. By focusing on that which we can change and have a sense of agency and volition, we have a better chance for post-traumatic growth and internal contentedness. So it seems that after a few weeks following the unfurling of the pandemic, a profound sense of uncertainty and the loss of control have become prominent for many. This in turn can manifest a sense of intense emotional vulnerability. This vulnerability seems to be a veritable fork in the road. We can go down a path in which we deny and push away or stuff down our emotional responses to the pandemic, or we can take the more challenging route of allowing our emotions to percolate within, however painfully at times, and to make sure we are buffeted by a stable and predictable schedule of self-care while we do so. There are researchers with whom I agree that post-traumatic growth will indeed be one of the sequelae to the COVID-19 pandemic. I believe that as we rappel through the trauma of the pandemic, from possibly having the illness itself to the economic, occupational, and interpersonal fallout, we may develop through the process of sitting through these difficult situations a heightened sense of appreciation, more authentic relationships, and a new sense of confidence. I can see how we are already going through a sense of communal growth as well. Look at the 7 p.m. celebration of healthcare workers each night here in Vancouver. People stand outside, banging pots and pans on their balconies, hooting and hollering, and just many people along all of the high rises in this area. And it's wonderful to hear, and you really do feel less isolated and more at one with your community. Also, that people are congregating to send loving messages to residents of healthcare centers because the elderly are having a difficult time, of course, being isolated during COVID-19. So I do think that there is going to be some good that comes of COVID-19. So even though it's too early to have full research papers out on post-traumatic growth, specifically regarding COVID-19, I'll be happy to be one of those people who holds out hope that this pandemic can manifest some positive, if not life-changing for the good, benefit. Thank you. So that is my talk. I'd like to see if there are any questions. Let's see here. See. Well, not seeing any questions as of yet. Usually I do. Well, I might as well talk more about post-traumatic growth. You know, I think that it is imperative that more research be done. I think it's also imperative to balance out the primary negativity that is what you see on the news regarding COVID-19. I know here in my home, we limit news, or we get a sense of like, you know what, that's enough news. We need to turn this off because it can become both upsetting and anxiety provoking. And usually the way it's presented, it isn't obviously presented in a positive light. It's usually in a more pessimistic light. So I think we have to be able to see, you know, when we come through um, this pandemic, that it's going to be difficult. We're not simply going to jump back into our everyday lives and go back to work. No, I think it's going to be actually somewhat difficult. I already can see that when I go outside, which is very infrequent, quite frankly, when I do go outside, and for example, I had to walk to our children's school today, it felt strange. I felt like I was walking into foreign territory. Like I knew where I was clearly, but I also felt somewhat uncomfortable, even though I was wearing a mask. And I found that really interesting. I didn't really understand why I felt that way. And then I realized how many months has it been since I've actually walked to the school, number one. And number two, the environment is new again. And so that in itself is going to be an adjustment. So let me see. Here's a question. This is a good one. How have you experienced traumatic growth in your life? Well, let's see. I can think of a couple instances of that. I'm trying to think of probably the most salient instance. I think probably being hospitalized for bipolar 2 disorder 4 times, and then having to live in a halfway house um, for a week. Um, Even though at the time um, I knew I needed to be in hospital, I knew and I felt comfortable knowing that I was safe. It is still quite traumatic. You know, you go in from being a professional and a psychologist, and you have all this work, and you present yourself in a certain professional manner, and then you go from that to wearing mismatched, oversized pajamas and really bad food, and you know, not really knowing what my next steps are. I had to be adjusted for medications. I was scared about that too. So all in all, the experience was quite scary now that I think about it, although maybe at the time I didn't. So when I came out of hospital, I realized I had to adjust to being back home, as happy as I was to be back home. I was kind of out of the safe confines of hospital walls because everything was done for me, and all I had to do was sort of lie in bed and read if I wanted to, frankly. And so what I did was when I came home, I tried to open myself up to the possibility that this was awful, this was scary, and this was traumatic. And I had to sit and really cry and really feel the fear of what had just transpired and how this was life changing and how this would affect my family. How would this affect my children? How would this affect my husband? Did I feel safe having friends again? What would people think if they knew that I had this? Of course, this allows me to segue into why I got involved with the Stigma-Free Society in the first place. But I did grow. I did have positives out of that. I thought I was empathic before, especially being a psychologist. I'm even more empathic now. I I feel much more for people, even with people that maybe particularly I don't care for, or even if I don't like very much. I still try my darndest to find something within them that's decent and good, because I know that's the right thing to do. So there's the answer to that question. I hope that worked. Here's some more. Can you tell us more about your mental health journey? Okay, I think I said a bit about that. Let me take a look. What practical coping strategies can we use to grow from traumatic experiences? I think some of the best coping strategies we can use from traumatic experiences, I really hope that you engage in a schedule of self-care. It's very, very important that you take really good care of your body and your mind, of course. That's why in every talk I give, I do admit, push meditation and yoga and ways to calm the system down. Because you see, when you have trauma, even COVID-19, which I do count as a collective trauma for the world, you know, we have this hyper arousal. We're on hyper alert all the time. So it's really incumbent upon us to bring our physiological systems down. And that's why deep breathing and progressive muscle relaxation, yoga, like with Fantasia, which he teaches here on Stigma-Free, are so important to that process. In terms of the psychological sequelae to trauma, of course, being a therapist, I hope people go into therapy to work through their trauma. It's not something to be messed with. And I think it takes a trained counselor, a trained therapist, a trained psychologist to really work through some of the deeper parts of trauma. Let's see. Let me see. I'm reading a biography about Albert Einstein. It happens that some of his most successful work occurred during World War I, and his mother had stomach cancer. He struggled in many ways, and yet he came out of it intact. Do you think, let me see here, I just can't quite get to the link here. Hold on a second. Do you think, here we go. That's not it. There we go. Do you think this rings true to what is happening now? He struggled in many ways, and yet he came out of it intact. Do you think, I mean, I think it depends. I think it very well could have happened to Albert Einstein. I think this is fascinating, and I did not realize that this happened to him. The fact that he went through those struggles, I would not be surprised, paved the way for allowing him to come out intact. Because when you say struggle, I mean, it's a general term. So what I imagine is he had some psychological difficulties coping with his mother's stomach cancer. Completely normal. I understand that. So when I read that he had these struggles and came out intact, it could be that the fact that he was so in touch with his feelings and allowed himself to feel these things and go through this process is what exactly allowed him to come through intact. So yeah, I actually do believe that would be the case. Now, of course, I would have to read that amazing biography, which I haven't yet, to see if that is proven true. But boy, that would be fantastic if that were the case. And let's see. Let me see, anything else here? Can you tell us a bit more about your mental health journey? I have just a few minutes left, and I want to just add that coming through my bipolar 2 diagnosis and hospitalization and halfway house stay were, of course, traumatic now that I look back. But I want you to know that I have completely accepted those experiences. I have felt the gamut of emotions regarding those experiences. I have shed many tears regarding those experiences. And I really do feel like I am a better person because of those experiences. Now, would I wish those experiences on another human? Absolutely not. No, I wouldn't. But I'm glad I had the opportunity to go through this and struggle with such supports that I had, and that I had the opportunity to, I had the opportunity to heal in an environment that was so loving and accepting. And I owe that to my husband and my children, who, though probably very scared, were very accepting. And so there's my mental health journey. Well, I think we are about out of time here. Again, thank you so much for listening to my talk. And again, I really, really want you to donate to the link that is somewhere around me during this presentation. And it's really important to help the Stigma-Free Society. I can tell you personally, it has changed my life. And, you know, for anyone with mental health issues, if you feel alone, if you feel scared that you are being judged, the Stigma-Free Society is the place where you can learn that that is not the case. And, you know, and it's a wonderful site with some incredibly wonderful resources. So please donate now. Don't wait. Thank you so much. I'm Dr. Dana Wasserman. Take care.